So how do we actually treat that? I talked a lot about what they are and somewhat scary side effects, but actually have good ways of treating them. And the good news is as time passed by, the treating physicians and the treating nurses, they got so much better in recognizing these syndromes, recognizing the side effects, and actually acting very fast to treat. So for the CRS, when patients have a fever, we can start medications that are actually simple, things like Tylenol. But we may actually give them some fluids. We may put them on some oxygen to help their breathing. We may use this special medication called tocilizumab, and you don't have to focus too much on that, but think of it as an antidote for all that inflammation. And if needed, we can also use corticosteroids, medications like that are the same family as a amiodarone dose pack, dexamethasone or decadrone or prednisone that lots of patients have used for other reasons. They actually calm down your immune system and prevent a lot of those events. A little bit differently, when patients have symptoms in their brain, that ICANS syndrome that I talked about, we have to make sure we are supporting those patients. So we have to make sure that if they are confused, they don't have trouble eating well, they don't have trouble that could make them fall, for example. So we always like to make sure that that environment is safe for all of these patients. We also use those corticosteroids, the medications like the decadrone, the dexamethasone, but sometimes we actually have to ask help from our colleagues in the neurology group, or sometimes even in the ICU, not because those patients are too sick that we cannot treat them, but because we like to have assistance for our team so everyone can pay attention in those that are having those adverse events and make sure that they do well. Some other things that we do is actually to prevent those side effects. And what we have lots of times is actually have these patients come to our clinic and spend a long time, or more commonly, actually come to the hospital and spend a night or two with us, just so we can monitor. Because in case something happens, we can act right on it. And after patients leave the hospital or the clinic, you also want to make sure that they have the clinic number ready on their phone so they can call, they can make sure to contact the treating team, but also we want them to be close by. So the clock and the car here, what they're showing is that patients should be around. So actually, your treating doctor it may tell you for the first few days after you receive these medications that you should be around the treatment center. So in case of anything happens, you can hop in a car, drive to the emergency room, or drive to the clinic so they can assess you and make sure that they act early, because that's the key to treating the side effects from these bispecific antibodies. The sooner we act, the better the results are and the safer the patient is.